I realized that I was having a heart attack. I entered a black tunnel. I knew perfectly well that I was dying. Hello to those interested in near-death experiences. Welcome to another experience. Before hearing this experience, don't forget to subscribe to the channel and support it with likes and comments. One morning, I woke up to go to work. It was the year 2014. It was a tough year for me because I had work and family problems, and I was under a lot of pressure. One morning when I woke up to go to work, as I pulled the car out of the parking lot and got in front of the door, I started feeling pain in my chest. It was like a tightness in my throat. At first, I thought the problem was with my stomach or due to food. I got out of the car. I parked the car and went to the store next to my house to buy some juice to see if the tightness in my throat would go away or not. Then it became much deeper and turned into a severe pain in my chest. It felt like something was falling into my chest. Considering my medical history and the fact that I am a doctor myself, I realized that I was having a heart attack. I wanted to call an ambulance, but the area had poor reception. I called one of the hospitals affiliated with our university, to Dr. Tukey, but he didn't believe me. He thought I was joking. He had put his mobile phone on speaker so everyone could hear that I said I was having a heart attack and was coming to the hospital. Everyone laughed at me. I told him that I was serious. I drove from the east of Tehran to the west to reach the hospital. When I was halfway there, one of the doctors was coming towards me in an ambulance. I told him my route so he could find me when he saw me on the way. The pain became very severe. The hospital was also calling me asking where I was. It wasn't right at all that I was driving at that moment. I finally arrived at the hospital and entered it. I lay on the bed and asked the nurse to take an ECG from me. An emergency specialist came to me. He asked me what had happened. He also smiled when I said I was having a heart attack. The ECG was prepared, and they found out that I had indeed had a heart attack. They told me not to worry, that I was here, and they would solve my problem. After taking an angiography, it was determined that the right coronary artery of my heart was 100% blocked. They inserted a stent into that artery to remove the clot. At that moment, my pain had become very severe. I was conscious and witnessing the whole process. I heard the doctor say that his heart rate had become normal. I separated from that space and felt detached from my body. I entered a black tunnel. The end of that tunnel was full of light. I can't say that it was a place there. It was more like a fluid space. It seemed to have a continuous structure. I felt like I was heading towards a pleasant space. That light was completely white. The distinction between the tunnel and that light had a black and white contrast. I wasn't caught up in time there. I felt transcendent. I was in that tunnel in two ways. I was seeing myself in snippets of my life passing by. For example, from when I was 2 years old. In normal circumstances, one may not remember some events and people, but I saw all of them. I saw a snippet from every part of my life. And I saw that my age was gradually increasing. I knew perfectly well that I was dying. This was a matter of course for me. I had no fear or astonishment. I didn't have any bad feelings in those conditions and was calm. In my belief, I had passed from one stage to another. I have 2 children. I saw my daughter being born, the resident who helped bring her into the world, in a way that I couldn't remember in ordinary circumstances because I have seen thousands of doctors and can't remember their faces. In another scene, I saw my son, who was wearing a very nice green outfit and playing. For a moment I thought he was very young. I returned to life, because he was 3 years old. I knew I was dying and would be separated from them. When I said the sentence that brought me back from that tunnel, I saw myself in the room. I heard the doctor say that he was fine. His heartbeat returned. All these events I described took about 40 minutes from the moment I felt the pain and brought myself to the hospital. The angiography also took about 20 minutes. Since not much time had passed, the muscles of my heart had not been damaged much. After these events, during recovery, I told the nurses that I still had some pain. I had called my brother and told him about this incident, asking him not to tell anyone, but he had told my wife, and both of them had come to the hospital to see me. I told the nurse that I still had pain, so please inject me with some pain medication. When the drug was injected into me, they transferred me to the CCU. After that, a few people came to me, and I understood everything up to that point. After they left, I fell asleep. Due to fatigue and the effects of the medication, I drifted off to sleep. It was around 3 to 4 a.m. when I woke up. For a moment, I asked myself, where am I? What is this place? I thought that everything I saw and all the events that happened were a dream until I saw my clothes. Even when I touched the 4 in my hand, I felt the pain and realized what had happened. After a few days, I was discharged and went home, where I realized that I had experienced such events. My vision there seemed three-dimensional. For example, as we see a footballer's movements from above a sports stadium and have a complete view of it. The person reviewing memories there was me. In one memory, I saw that when I entered a pool in our yard, I felt getting wet. I was seeing the child, who was myself, and feeling his emotions. For example, if I saw a memory where harm came to me, I felt pain. I was both an observer and the person experiencing those memories. These experiences are different for each individual, but the generalities of these experiences are the same for everyone. After this experience, the meaning of death changed for me. The peace I felt there was because I always believed that death is an extension of life. We don't completely cease with death. This experience proved that to me as well. I am going through a stage to enter that other world. As a doctor who has experienced this, that place was something different compared to our normal life. I could easily move around and see myself in snippets of my life that don't happen in ordinary life. Thinking about memories in this world is very different from what I saw in the life review there. Because it's in the conscious mind, and I don't have access to my unconscious. In my unconscious, something beyond my consciousness exists. Things happen there with my will and intention. But there, things didn't happen with my will. I was there in a dual role. I was the observer and at the same time, the one living those experiences. I knew I was dying there. The conditions were very pleasant for me. These are the differences that make one think that a transcendent event is taking place. Dr. Hamid Zahidi, an anesthesia specialist and a university faculty member, defines and differentiates sleep, anesthesia, coma, death, and clinical death as follows. Sleep is a natural phenomenon that occurs in the daily lives of individuals as long as they are alive. During sleep, physiological activities in the body decrease until the end of sleep. Anesthesia occurs at any time and place, depending on the procedure to be performed. By using anesthetics, the patient is artificially induced into sleep. There are 4 components that must be present in anesthesia: analgesia, muscle relaxation, and amnesia. The patient's level of alertness should also decrease and be under control. After the operation, the effects of anesthesia drugs decrease and the patient regains consciousness. Clinical death, or near-death experience, is a state where the patient loses their breathing and blood circulation. In this stage, if we help the patient in time, the likelihood of survival is very high. Many factors are involved, such as age and underlying diseases. If we help the patient within 4 to 6 minutes, the patient can survive. However, if it takes longer, the patient usually does not return to life. Sometimes the patient may fall into a coma. In this state, the level of consciousness of the patient is severely affected, and the activities of various body organs such as the heart, brain, and lungs become disordered. Depending on the disease factor and underlying conditions, the chances of return may vary. In some cases, the patient may suffer brain death and may donate their organs. In state of death, all body functions are completely disrupted, and none of the body organs are active. According to religious beliefs, the soul leaves the body, and the body no longer functions, leading to death.